China WHO joint study. And now let's listen in the live signal.
Gentlemen, dear media friends, good afternoon. Welcome to the press conference of WHO convened China part of the global SARS-CoV-2 origin tracing study hosted by Chinese expert members. The origin tracing has received high level of attention from the international community. On the 9th of February in Wuhan, we hosted a press conference. Since then, the joint expert team carried out intensive communication through video conferencing, email, and other means. After nearly 2 months of joint efforts, agreement has been reached on key consensus regarding the methodology, key findings, scientific hypotheses, and next step recommendations regarding this joint origin tracing study. On the afternoon of the 30th of March, WHO hosted an information briefing session for member countries and press conference and answered questions from the media. With the press conference today, we have invited the chair for the Chinese experts of the joint study group, Professor Liang Wannian, Mr. Feng Zijian, head of epidemiology, Mr. Tong Yigang, head of the group of animal and the environment, and Mr. Yang Yunggui, head of the group of molecular biology. So they will together give us a briefing and answer questions from the media. We will have simultaneous interpretation for this press conference. You can ask your questions both in Chinese and in English. First, I'd like to invite Professor Liang to give us a briefing. Dear friends from the media, good afternoon. Yesterday, WHO officially launched the WHO convened joint global origin tracing study China part. Yesterday, our international colleagues hosted a press conference, and all of us watched it attentively. Our international experts hosted a very excellent briefing by providing comprehensive answers to many questions of shared interest. It was an excellent session, and we take great pride in what they have done. Over the past several months, as a joint team, Chinese and international experts have been working extremely hard. Despite all the hard work, we believe it is worthwhile. And throughout the process, we have kept pleasant cooperation in a very cordial way. And today, I'm very glad to see so many friends from the media gathered here, so that we will have the opportunity to give a briefing to more friends about some aspects of our joint study on SARS-CoV-2 origin tracing. On the 9th of February, after finishing the China part of origin tracing, Chinese and international experts hosted a joint press conference in the city of Wuhan regarding the process and results of the China part of the study, as well as next step recommendations for global origin tracing. A systematic briefing was provided with that press conference. With the full volume of the report published today, it builds on the foundation of the work in Wuhan while taking into consideration more extensive sources of information from the perspective of global study. The key sections of the report are basically in keeping with the briefing provided on the 9th of February, without principled difference. There's some grammatical polishing to make it even better. It is a lengthy report covering a lot of content. The joint expert team consists of globally leading scientists, based on scientific and prudent principles. We had been working very hard, talking to each other every day before the publishing of the report. And a great deal of detailed description was provided covering epidemiology, molecular epidemiology, the animal and the environment as the key aspects. There's been a tremendous amount of data processing and analysis. For the next step recommendations, they are given from the perspective of a joint global origin tracing with overall planning and careful contemplation. Now, its publication has everything to do with the hard work of all the experts. Here, on behalf of the Chinese experts, I would like to sincerely thank all the international experts. I would like to pay tribute to all of them. Now, I would like to give you a briefing on the process, key conclusions, and the next step recommendations of this joint study. About the key conclusions, in bat and pangolin samples, coronaviruses were discovered with a high level of similarity to SARS-CoV-2 in terms of genetic sequencing. However, the similarity is not sufficient to make them direct ancestors of SARS-CoV-2. Minks and cats are highly susceptible to SARS-CoV-2. So we should keep in mind that bats, pangolins, mustelids, feline animals, and other species could all be potential natural hosts of SARS-CoV-2. Through extensive search of earlier cases and the testing of retained samples, it is discovered that in December 2019, there was a certain scale of circulation of SARS-CoV-2 in Wuhan. The first case was dated to the 8th of December, predating the first case related to the Huanan market on 12th of December. Most of the cases were concentrated in the second half of December 2019. The Huanan seafood market is one of the points of outbreak of SARS-CoV-2. However, it is possible that in other places there were circulations in Wuhan. According to environmental sampling, after the closure of the market, in its environment, there was extensive contamination of a SARS-CoV-2 virus, notably in aquatic products vendors and stores. So there is the possibility that the virus might be brought to this market through contaminated or polluted cold chain products, animals or animal products. With massive testing of animal products in this market, there's been no positive result. We are yet to test cold chain products. For bats in Hubei province and large quantities of farm animals and poultry and wild animals in China with extensive testing, no SARS-CoV-2 was discovered. So before and after the outbreak, there is no evidence pointing to circulation of SARS-CoV-2 in farm animals, poultry, and wild animals in China. Our joint expert groups looked at the four potential pathways of spillover from natural hosts to human beings through cold chain food, direct spillover, zoonotic spillover, spillover from intermediary host to human beings, and laboratory spillover. There are 5 levels of judgment: extremely unlikely, unlikely, possible, likely, and very likely. So we have 5 levels of judgment. For direct zoonotic spillover, it is regarded as something ranked from being possible to being likely. The spillover through an intermediary host is regarded as ranging from likely to being very likely. with regard to the introduction through intermediate hosts. Introduction through cold chain or the food chain is regarded as a possible pathway, and introduction through a lab-related accident is regarded as being extremely unlikely. So there's been a consensus stricken by the joint team that those hypotheses, scientifically speaking, are not geographically confined. From the very beginning, the experts adopted open-mindedness in research, because for the spillover and the introduction of the virus, its zoonotic transfer and other pathways all the way to the outbreak in the Huanan market, it could have taken a long time, and it might have involved long-distance movement, including potentially cross-border movement. Therefore, we need to be even more open-minded without being geographically confined. We need to pay attention to different regions of the world so that we can pull together information gathered from different parts of the world and through different channels in order to help us better understand this virus, to trace its origin. So before the outbreak in Wuhan, what had exactly happened? So next step recommendations. Because we need to adopt a broader vista of joint global multi-site origin tracing with regard to next steps. The international experts and the Chinese experts are both very serious and prudent. So we have carried out multiple rounds of science-based discussions. We have the key following recommendations. First, we've got to expand global database, including molecular, genetic sequencing, clinical, epidemiology, animal monitoring, and environmental monitoring related data and database. Recommendation number 2, within a broader scope globally, we need to continue to look for potential early cases. In China, we have carried out relevant work. In the future, it is necessary that we broaden the scope of research to look for more materials for testing. Recommendation number 3 is about animal host. Scientists around the world need to work together to carry out related research in multiple countries and sites, so as to search for animal species that might serve as hosts for the virus. Number 4, we need to further understand the role played by the cold chain and frozen food in this process. While the China part of the joint research has been concluded, but the origin tracing is not concluded yet. It is our shared expectation that it has served as a beginning. Hopefully, going forward, with the leadership of WHO, scientists from all across the world will join hands to continue conducting this endeavor in a science-based way. That's my briefing. Thank you very much for your attention. Thank you, Professor Liang. Now the floor is open for questions. Before asking a question, please identify yourself with your media affiliation. Please. First question, lady from the second row. Well, today we have seen the report of the joint study. As the team leader for the Chinese experts, how will Professor Liang comment on this report? And do its conclusions accord with the analysis and the prediction that Chinese scientists made at the very beginning? Thank you for your question. For the report of the joint study, it is the report for the China part of the global origin tracing study. This report serves as a crystallization of the hard work of WHO and the Chinese scientists. It's a joint scientific research report based on science and facts.
In the process of conducting this origin tracing exercise by the international expert team in China, we have adopted 4 commons as our principles. That is, common development of the TOR, common conduct of the scientific research, common preparation of the study report, and the common release of the joint study findings. So those principles underscored what we did in the process. We worked assiduously together, and I think both of us paid a lot of efforts into this exercise. I must say that this is an excellent example of international cooperation on joint scientific study. Because the cases are already about a year old, many of the samples, products, and also in the environment, some of the retained samples may have been gone, and we didn't know much about the virus, let alone understanding it. So we may not have all the samples in place, so we did a lot of searching. I remember yesterday in the press conference, our Australian colleague on the team said something very eloquently. We should not use our knowledge and understanding of the virus today to examine what we made as decisions when the outbreak started. And I think this is a case in point when it comes to the samples. On the other hand, there are possible biases in the memories of the people involved, because this is a retrospective study. And also the methodology and also some of the tools that we use in the exercise have their limitations. They are not perfect. But we believe that the report is still very valuable, and we believe it serves as the basis for our onward study about SARS-CoV-2, about the outbreak of the virus, and also for other emerging infectious diseases. And we believe the report withstands the test of time and history. As members of the joint study team, we've been saying that we are confident that the report is based on information and evidence available in our position, and it's going to withstand the test of science. But we will have to improve the technology around and also to pursue further study. On the basis of communication and collaboration, Chinese and WHO experts have sought truth through facts, and we have remained open and transparent and collaborative. China, as the first country to report the cases of SARS-CoV-2, took the lead and completed the China part of the global study. As members of the joint study team, the Chinese experts feel both responsibility, and we also feel that there is a mission incumbent upon us, and we have to deliver. Of course, this is an ongoing effort. The conclusion of this chapter of the global study, as I said, does not mean that the study is concluded. Going forward, we will build on the findings made in the China part. We will further pursue study more extensively through multiple channels. And from an expert point of view, we will continue to participate actively in WHO-convened origin tracing exercises in other parts of the world. Thank you. Next question. Writer. Yesterday, Tedros, the Director General of WHO, mentioned that it was difficult for some of the members to gain access to raw data from the Chinese experts, and they cannot exclude the possibility of a possible lab release, and it requires further investigation. I want to ask why such raw data was not provided by China, whether China will be providing such data. Will China be hosting another team to further look into the hypothesis of a lab release? We will direct the question to Professor Liang. Regarding this question, what you said about China not providing the raw data, I think the assumption and also the question itself is not founded in facts, because when the international expert team arrived in Wuhan, as I said, we emphasized the 4 common principles: the common development of the TOR, and analysis and examination of the evidence presented to us. So it has always been our sense that the information made available to us Chinese members and to the international members are the same. There's no inconsistency or gap. When we had the information will be given to members of different groups based on their expertise, and they will look into such evidence from different angles. And the Chinese members are highly integrated into those teams. So this is not a separate exercise, China working on Chinese materials and the international experts working on international materials. So we divided the team into 3 groups based on members' expertise, and they worked together as one. So if you were to assume that information was not shared or provided, that is not founded in fact. But under Chinese law, some of the information cannot leave the country because of privacy and confidentiality concerns. But when we were in Wuhan, the database was viewable, accessible to all, and we worked together on the data. For example, if there's any information that relates to patient privacy under Chinese law, we will have to respect the law. I think this is also a common norm in the international community and understandable. So I would like to respond to your first point. Second, how do you define raw data? The nature of data and how you characterize data, I would like to make a footnote here. There are many types of data. We have the underlying data that could be unstructured and very diverse, and it could relate to many subjects. So it has to be sorted and grouped, and then it will be data useful for data analytics. For example, it will have to be grouped by demographic, by their conditions, by their age groups. So that's about structuring the data. Even with structuring, data cannot be fully analyzable. So you will have to mine the data, integrate and aggregate the data so that it can become more like intelligence, insights. And that information will be more useful. In the process of the joint study, we started with very raw, unstructured data, and when we got to the point of a useful, usable database, it actually required extensive efforts. A lot of structuring, sorting had to be done. It's understandable that you will have to examine the entries of each case, and if that were to be done by one team, it would be impossible. So it had to be broken up and performed by different members, because we have 500,000 entries or paper documents laid in front of us. It will be a tremendous effort to go through them. So as I emphasize, what the Chinese members could see was the same to what the international experts could see. And then what Dr. Tedros mentioned, I don't understand exactly what he's coming from. This is a matter of science among scientists. Scientists prepare the report based on information available. So history science will be the judge of whether the report is complete or not. And as I said, we are only on the China part. The China part of the global study has just been concluded. So we will have to widen our scope. The Chinese scientists are willing to work with international experts and counterparts, focus on science of origin tracing, and focus on the goal of finding the root of the virus as our ultimate purpose. And I believe through our concerted efforts we'll go there. But as to where and how, in the recommendations for next steps in our report, I believe there is some clarity and we can act upon some of those recommendations. That requires concretizing the recommendations in terms of methodology, location, region. I think specific actions, plans will come out of them. So based on the current shape of the study, I think there's a further need to pursue this exercise further, but how, it depends on our further consultation. Thank you. Next question. From YNA, regarding the WHO released report, there has been a joint statement from 14 countries, including the US. They raised concerns about the possible delays of the release of the report as well as the lack of complete sets of data. What's China's position on these? So we will direct the question as well to Professor Liang. Regarding your question, first on February the 9th, we held a joint press conference in Wuhan as a joint study team, and we identified the main findings, the key findings and conclusions. We built a consensus, but that consensus was more like a framework, and they are generic conclusions because we worked 28 days in Wuhan and we were working in a very tight period of time, and having an extensive report will have to take time. The experts will have to verify what they say in the report, each line, each paragraph, and between the lines and paragraphs, there will have to be some logical connections, inferences, and it will have to be scientifically robust. This is prepared by scientists, so scientists value rigor, and it has to be evidence-based. At the same time, when the scientists left Wuhan on the 10th of February for their respective countries, because of time differences, we were not in the same location anymore. So you will have to make the scheduling work for everyone. Some may have to work during the night. So it took some coordination effort. At the same time, the translation of the report will have to be made available at the same time. When we have the English version, we will have to make sure that the Chinese and the English can check out.
So there have been multiple rounds of coordination and working together remotely. It has involved a great deal of verification and discussion for the experts to draft this report. It's like doing traditional Chinese embroidery, like a weaving with needles. Because when this report is published, it will be read by the entire world, not only by professionals, but also by the general public, media, and just people we come across on the streets. Everybody would be interested. So every sentence shall be built on science and sound logic. So we are exerting our utmost to make sure it is sound and scientific. So the so-called delay in its publication is a misconcept to start with. We have never held any notion like a delay, such as delay. Quality is the top priority, and the time is secondary to quality. Only when the joint expert team experts have confirmed the report or agreed to the report, would it be published. We have not preset any timeline, but we're also aware that the entire world was waiting, so we worked day and night to expedite. That's how I would address this question. There had been no interruptions. There had been no laziness. There was no delay in its publication. We did everything to ensure its quality and scientific rigor. That's what I want to explain about this. Well, regarding the completeness of data, for whatever research, nobody could guarantee that you have obtained 100% complete, perfect, flawless data. That's part of science. For an emerging infectious disease like this, from day one, we observed a science-based approach. At our first video conference, we made it clear that the report could always be better. We are never going to have a perfect report, and mankind is deepening our understanding of this disease at the same time, and technologies are evolving as well. So based on the information available to us, we will make a scientific call and conclusion as best as we can. That has always been the guiding principle. What data can be called complete? That's another question of science. How much data can be called complete? If you get, is it possible for you to get all data? What do you mean by all? So for the completeness of data, from a scientific point of view, there is no concept that is agreed by all or recognized by all. But well, on the part of the joint study team, as soon as we arrived in Wuhan, and even in July last year, when we hosted the advanced team from WHO with 2 experts, Chinese scientists, worked with them for several weeks, making preparations for the China part. We jointly worked out the terms of reference, the TOR. And in our discussions, we discussed about the dimensions and the angles of data collection. Animal data, early case data, testing data, as well as related data from potential chains. We had a lot of discussion on what to collect, where to collect them, what types of data we need to obtain? What are the methods for us to obtain data? We had a lot of in-depth discussions from the very beginning. I can still remember that after arrival in Wuhan, for the first 14 days, they needed to go through the quarantine period. For week 1, we spent 5 or 6 days discussing our program of research day by day, for each day what we would do. And we spent the bulk of the discussion on how to obtain data, what data was to be obtained. So in retrospect, I still firmly believe that based on current levels of knowledge and working conditions, we have tried our best to gather everything we need to gather. But, nothing is going to be 100% in terms of data collection. Our conclusions are based on data we have obtained, plus the scientific knowledge and experience of the experts, plus some science-based reasoning or inference. So you can never say, because you don't have 100% of the data, the conclusions are not good. In the medical science, we have sampling or sampling-based studies. It is even more effective in many ways than across the board or blanket testing. Thank you. Thank you. Now, let's go on. Lady from the 4th row, please. From Kyodo News, I have 2 questions. Question number 1, it is still a follow-up question on YNA about the joint statement from the 14 countries. Well, what about the delay in the publication of the report? 1 year plus later than the outbreak in Wuhan, the study was conducted. In the joint statement, there's a view that the joint study was conducted a little bit too late. How would you comment on this? Question number 2 is the same like the Reuters question, which has been answered. But if you take a look at the report, it calls for further studies in China or elsewhere with even more thorough and deeper going studies, such as farmed animals or animal farms in China with further origin tracing. Is China ready to host more study missions for origin tracing in China? A set of complex questions. Professor Liang and then other experts might have something to add. Yes, 2 questions. Well, question number 1, the question is about the timing of the study. In January this year, the WHO mission arrived in China, forming a joint expert team with Chinese experts. Is it too late? Well, China was the first country to report COVID-19 cases. But globally speaking, we can also say that China was the first country to work with WHO on origin tracing. Whether it's sooner or later, early or late, you don't have a specific or authentic criteria to make such judgments. In the early stage of the outbreak, Chinese scientists had already started to do some origin tracing work. So very early on in Wuhan, a large number of scientists in China were in Wuhan fighting the epidemic while using our professional expertise to trace its origin. For example, in the Huanan market, very early on we started environmental sampling and animal sampling and testing. Whenever there's an outbreak in China, we will build on past experience of coping with it. Whether it is, then it took some time before international experts came to join the work. I don't think it's late 1 year after the outbreak. There were a host of factors to decide when international experts came to join the work. As long as everyone is working based on science, never is too late, as long as it's science-based. And I think from a perspective of an expert, China was the first to conduct a joint global study together with the WHO. It also demonstrates the attitude of the Chinese government as a scientist. I would like to commend it. And moreover, in terms of our knowledge, capabilities, and methodologies available to us, Chinese scientists will continue to conduct origin tracing until the day the origin is finally located or found out. Regarding your second question about next steps, will we conduct further analysis into data from China? Would you continue to look at factors along the transmission chain? Will we conduct more animal studies in China? Is China ready to host a second or even third WHO mission to China? Well, I think in principle I've already answered this question. Definitely there will be more analysis and studies. The Chinese scientists are ready to work with their international peers to trace the origin of SARS-CoV-2. We will continue working hard until our objective is met and the origins are identified. Our children, our grandchildren will continue working towards that objective. But origin tracing is a systematic and complex project. It's never going to be accomplished overnight. If you take a look at history of infectious diseases, especially the history of emerging infectious diseases, there's a common understanding that if you want to trace its origin with an authentic conclusion, it takes a long, long time. For many diseases that have been circulating for decades, we have not identified the origins yet. But even without finalizing on the origin, we are effectively containing and intervening in those diseases. So definitely we will continue our studies. Even if WHO would give up the effort of origin tracing, Chinese scientists will stay put and continue working on that. And for data analysis, yes, data analysis is part and parcel of origin tracing. And we will continue to focus on those key potential avenues. What animals are the natural hosts? What animals could be the intermediate hosts? What could possibly be the pathways of transmission or spillover? Yeah, we'll continue to look at data and samples, and we'll continue testing. But, well, potentially for a second mission or third mission or whatsoever, it will be driven by the needs of the study. If origin tracing is only to be conducted in China, it's of course, misunderstanding. The origins are still unknown, and out of the 4 potential pathways, one of them being cold chain-borne transmission. Although Wuhan was the first city observing an outbreak, it does not necessarily mean the origins were there.
We have a consensus as scientists where we identify the earliest cases is not necessarily where the virus was introduced. So if this is the scientific consensus, then we will have to broaden the scope of origin tracing. For the next step, we will have to identify, as part of our joint study, global study, and in our recommendation section, we have some recommendations based on those lines, and the Chinese expert members under the leadership of the WHO will cooperate with any onward study. So as to whether the second or third study mission will come, I don't think anyone would know at this point. What I can answer at this point is this will depend on the progress on the global study, and then we will have to be driven by the needs, by the conditions. So the process will decide whether or not, when, and how and what to do when we come here. Any further comments from the other experts? No. Next question. Thank you from Phoenix TV. We've read some international reports saying that some experts are saying that the origin of SARS-CoV-2 is likely similar to the origin of SARS, the game market or the wildlife market. But in China, there's been some closure of such markets in southern China. So what's your view on that? Professor Tong will answer that. At the outset of the outbreak, the understanding globally of SARS-CoV-2 was very limited, given that the knowledge about the transmission zoonotic outbreak theory was pointing to possible wildlife animal hosts. And because of concerns of possible worsening of the virus situation, the Chinese government adopted some preventive measures, including limiting people movement and closing in full all the animal farms of wildlife animal. And it shows that the measures taken by the Chinese government in the beginning were effective in curbing as well as slowing down the transmission. China contributed to the health of the Chinese people and the world. About animals, the samples we tested in the animal markets did not show any positive results. We owe it to the State Administration of Forestry and Grassland and other government agencies. They took about 330,000 samples of domestic and about 40,000 samples of wildlife animals. So no sample tested positive. And before and after the SARS-CoV-2 outbreak, we didn't find any evidence of virus transmission among wild or domestic animals. We also examined the Huanan seafood samples, and then because there are other 14 countries and regions involved, if further investigation is needed, then we will have to defer to the WHO to coordinate further study. About the animals in southern China, including bats, Chinese scientists have performed very in-depth study. In southern China, we have discovered some virus strains that were very homologous to SARS-CoV-2, but not the same. And many of the animals are susceptible to SARS-CoV-2, and there's evidence supporting that. Up to now, we haven't found any evidence supporting the hypothesis of a zoonotic outbreak in southern China. And based on the extensive discussion between Chinese and international expert members, we have published our findings, and the findings will be made available also in the report. And about the other hypothesis, we have built upon our consensus that the introduction of the virus from animal host to human being is very likely, but there's no additional information corroborating such existence of chain of introduction, especially through an intermediate host. This is a very scientifically challenging endeavor, so we will have to rely on science. We will have to widen our scope and conduct more extensive, more meticulous research on more animal species. Otherwise, we may go astray in our research effort, and we call on international scientists to work with us. From CGTN, the joint study mentions some of the recommendations for next steps, including the effort to look for early cases of SARS-CoV-2 in a broader range and also globally. And we see that there's been such effort already by other scientists. There are reports saying that there are virus infections predating the SARS-CoV-2 cases in Wuhan. So what will be the priority of origin tracing going forward as the next step? Will we go to other regions or countries for such origin tracing? How long do you expect this will take? Where we found the early cases of virus may not necessarily merit that this is the origin, the place of introduction of the virus. And this is based on past experience. We have also read news reports saying that there are cases, positive samples that predated the cases found in Wuhan. We may have to verify those reports through further study, and we believe those leads may be useful for us to identify the exact timing of the outbreak, the possible animal host, natural host. Such efforts are worthwhile, and as Professor Liang said, the expert team has made recommendations in this connection. So in multiple countries and regions, in a global context, the study should continue. Thank you. From China, Xinhua News Agency. Could you maybe tell us what happened with the molecular epi study? And we know there are multiple variants of the virus that have been reported around the world. So what's your take on this? Professor Yang will answer this question. Thank you very much for the question. The origin tracing effort, and as far as my part is concerned, molecular epi, we have systematically examined the genetic sequences of the early cases in Wuhan. We have also examined and searched the sequences of early cases in other countries and regions, and then based on the known and unknown genetic sequences, we built the genetic sequence database, which was most critical and essential for molecular tracing. So based on our efforts, we've made such progress, and I would like to update you on that. We have established a global SARS-CoV-2 information database, which aggregates genetic sequences as well as possible clinical epidemiological data, which provides further information and data for molecular biology study. Second, through the combined study of epidemiology and molecular biology, we have tried to establish some pattern as well as correlations between the variants of the virus and the exposure factors. These provided references for possible directions of the sourcing effort. Third, we have also run some theoretic study on the possible evolution and homology as well as the common ancestor of the virus to understand the pattern. And we have also fully integrated the early cases, the environmental as well as early retained samples, and conducted the NAT test and the molecular genetic sequencing. And as we said, we've made 4 recommendations on molecular study. So first, we need to have a globally integrated database, which will be led by the WHO, about the metagenomics, about the environment, about the genomic sequence of the different strains of virus. Then let me turn to the second part of the question. Because of the study of the original genetic sequences of the early cases in China, we have provided some valuable guidance about the depth and the breadth of the testing platform. Third recommendation. Based on literature research, experts believe that the samples that predated the Wuhan samples are there. So we have to conduct further study to identify those earlier positive samples. Number 4, we have widened the screening of species around the world. The last question, which is also on our radar, there's been various variants of the virus. We know this is an RNA virus, and given its property, mutation is a part of the natural evolutionary process. It's a process of adapting to the environment and to the human population. And it shows that the fight against the virus is going to be winding and daunting. I would like to take the opportunity also to thank the joint study team and our other sister groups, because the molecular group will have to rely on other groups for information for analysis. I would also like to thank China CDC for providing valuable support, including the China National Center of Bioinformatics. Thank you. Thank you from Hong Kong. Since the outbreak of the virus, China and the international community have been communicating. So what type of communication and study has been done? And in the recent exercise, what has been China's specific effort? Professor Liang will take the question. I'll try to address this question. Since the outbreak of the virus, China has been acting in accordance with the IHA and international health regulations. We've been reporting the WHO to the WHO and also updating on the recent findings of the virus, and any such information was shared through journal papers. I understand there was some study on the therapeutics, diagnostics, as well as the epidemiology survey and surveillance.
So we, on a timely basis and through different means, we communicated those developments with others. So from the perspective of a scientist and expert, I should say, legally speaking, coping with a new emerging infectious disease based on international law and the provisions of relevant Chinese laws and regulations. China have observed all of them. Second, in terms of information disclosure and communication, it has been fast, responsive, and timely, and also rule-based. Thirdly, for a novel virus, it's a common enemy confronting entire mankind. Therefore, it requires pulling together of cross-disciplinary expertise from etiology to epidemiology to clinical studies to laboratory testing, so on and so forth. It requires a global scientific collaboration involving different disciplines and fields. So from day one, it was we adopted an open approach and a cooperative approach. I can clearly remember that during those most challenging days of the outbreak in China, our scientists, clinicians, doctors, and physicians, while fighting against the epidemic, spared some of their precious time talking to international colleagues and peers with bilateral and multilateral exchanges and discussions. In particular, when China succeeded in containing the virus on the national scale, we were very eager to share the best practices, the learnings, and even lessons with all the others. So confronted by an outbreak of a major disease, only through communication, cooperation, and coordination will we be able to jointly conquer and defeat this devil. And scientists in China from different disciplines have been playing their respective roles and delivering on their respective responsibilities, from research to communication to cooperation. Scientists involved in basic research, clinical research, epidemiology, public health, and other fields of research have engaged in this cooperation all the way throughout the process. Thank you, Professor Liang. Yeah, for what Chinese government has done, let me provide some additional information. During the stay of the WHO mission in China, it coincided with a critical period for China to fight against the epidemic. So together with the local government and the host government, we always adhere to openness, transparency, and cooperation. We have mobilized all the possible resources to facilitate the WHO mission and to satisfy their requirements. So the WHO experts visited every place they wanted to, including Jingtan Hospital, Huanan Seafood Market, the Wuhan Institute of Virology, affiliated to Chinese Academy of Sciences, and they met everyone they wanted to meet, including healthcare providers, lab personnel, researchers, market managers, vendors, those recovered from the disease, and family members of deceased patients, and family members of deceased healthcare providers who died while fighting the virus. So we did everything, and I'd like to thank all the staff, thousands of them, who had been working on the scene and behind the scene. And team leader, Dr. Peter Ambarak, expressed his thanks to thousands of volunteers and working staff at the press conference on the 9th of February. Wuhan is a city of heroes, and the publication of the report and all the successes and achievements we have had could not have been possible without their support and effort. Thank you from Hong Kong, and also for Professor Liang. We have not confirmed the origin. What is the most challenging point? In the past, have we succeeded in tracing the origin of other viruses? Professor Liang. Well, with regard to origin tracing, it is a vastly complex scientific project. In the history of emerging infectious diseases, so far we do not have a precedent of successful origin tracing. So it's not with one study alone, we do not expect to answer all the questions, but we are confident in saying that with each phase of the study and with each report released, we are one step closer to the ultimate truth of its origin. So the difficulty of origin tracing lies in the fact that that virus observes a pattern of accidental spillover, leveraging a kind of a vehicle or a vector to achieve zoonotic transfer or spillover. So sometimes the transfer and the outbreak could be triggered off in a very accidental way. So how could we identify the interface, the zoonotic interface? It's like searching for a needle in the ocean. That's the most challenging part of origin tracing. And for SARS-CoV-2 virus, its very nature and specifics have aggravated the difficulty, level of difficulty, if it is stable, if it is easily identifiable, like a high fever, then it could be less difficult to trace its origin. But for SARS-CoV-2 origin tracing, back in February, when a joint WHO study mission was in Beijing hosting a press conference on the 24th of February last year, I could still recall that everybody was struggling to find the right word to describe this virus shortly after the separation of SARS-CoV-2. Everybody came to see its uniqueness. It is a sly or a very shrewd and sly virus. It's prone to mutations, and for symptoms it causes are so extensive, ranging from the highest severity or even mortality to mild conditions, asymptomatic or slightly symptomatic. At that time, we didn't have any knowledge about asymptomatic infection of SARS-CoV-2. So today, a large portion of those infected have no symptoms. So it's a very shrewd and sly virus. In origin tracing, it's got to identify the index case or patient 0. For the first reported case in Wuhan, according to current research, it was dated to the 8th of December. It was the first discovered case. It is by no means equated with the index case or case 0. So with tracing, origin tracing, we are looking at the first interface for zoonotic transfer or spillover. But for a case with asymptomatic or mildly symptomatic conditions, it's sometimes impossible to identify them in the first place. That's why it's so challenging. And moreover, well, if we want to trace its origin in animals, like bats, pangolins, mustelids, felines, as well as some other species, they could all potentially serve as hosts. But from a professional point of view, there are two types of them. First, natural hosts. Second, intermediate hosts. So from host to source of infection, it's another process. Some animals are reservoirs, but they do not infect others. But for other animals, they are hosts and reservoirs. And they can also serve as an amplifier of the virus, and they will release the virus into the outside environment. Then those animals could become sources of infection. So we still need to make a distinction between two types of animals. We are looking for SARS-CoV-2 in animals like bats. But even when we identify the virus in the bat, it does not mean that animal is the ultimate host. There's a probability that in the upstream there's another species that are that could be the most original host. So with regard to bats or pangolins, they are captured sporadically and accidentally, and then we will sample them, we will test them. During sampling, if they carry the virus, do they carry a high enough load of virus to be detectable by testing technology? Despite all the challenges, we have to do all this, even with regard to possibilities of low probability. We need to observe a science-based approach to study all those options and scenarios. It's challenging and difficult, but it's our duty as scientists. Thank you. Thank you. Next question. First row. Thank you. My question is for this joint study. WHO, there's a joint team of WHO experts and Chinese experts. What about the division of work? And in the cooperation, in case of differences, what mechanisms are there to overcome those differences? Still, Professor Liang, please address this question. Very good question. From the very beginning, we called it an international team with Chinese experts and WHO experts putting together one team. I can still remember that the team leader of the international experts, Dr. Peter, said, "We are a family. We have 30-plus family members, and the primary task of this family is to raise a baby, a child, which has been the report. So we have been working in the atmosphere of a family. As I've shared with you, we have what we call 4 joints. Everything's done jointly, and we are working together in seamless cooperation. We are all scientists doing origin tracing. Based on the 4 joint principle, we have broken down national boundaries, and by dividing the work into 3 groups. There are quite a number of subgroups, but the 3 broader groups are that of epidemiology. Professor Feng Zijian is the Chinese team leader, and Professor Fisher is the international team leader. And we have experts of epidemiology joining this joint group to conduct research. For molecular group, we also have Professor Maria heading the international experts and a Chinese team leader as well.
For animal and environment, we have Professor Tong and Peter Daszak as the Chinese and international expert leads. So in terms of shared responsibilities, we already grouped experts and formed a joint team based on their areas of expertise. And at the beginning, we had to go through video links. We had plenary, we had also breakout meetings, and there was coordination that was coordinated through me and Professor Peter Emberek. And then we had discussions as a group. The execution of the action points was picked up by the team leaders, and it was done in real time. So it feels that we were never separated as a team, and it was a very productive and a very pleasant experience. But for sure, in the process, there will be some disagreement, even in the same discipline. And also, we have scientists from different countries represented on the team. Even for scientists in the same discipline, they may come from different perspectives. So we will have to take different perspectives to the study, different approaches, different angles of interpretation, as well as the methodology for analyzing and aggregating the data. There will be different suggestions and different approaches. And for sure, we will have some debates and arguments. Some of the arguments could have been heated, but it's only natural. Scientists will have to argue together because the process of seeking truth, getting closer to truth, is a difficult scientific endeavor. So debates and arguments can bring us closer to the truth as the only possible way. So I've read some reports. Chinese experts and international experts had vehement arguments. I think it's a fair statement. Even among Chinese experts, we had very heated discussions and arguments, and across different groups, there were heated discussions. That's natural. It does not mean there's any contradiction. It's for the purpose of seeking the truth and developing a more solid basis of science. So I would like to underscore that. I remember the last plenary meeting took place in the evening, China time, and we spent a lot of time going through the report one paragraph by paragraph. And when we finished, it was already after midnight. It was almost daybreak. And I said, now we could see our child that's going to be delivered soon with a peace of mind. This is a child that's healthy, that's going to withstand the test from this world. So as scientists, I believe the joint team have felt 2 things mostly. First is pride. Thanks to our concerted efforts, we've produced a report that's valuable both for the current effort to control the virus and for our efforts to be more prepared. Second is confident. Based on information and our research, we believe that this is evidence-based and science-based. Thank you. Thank you, China News Agency. We talked about hosts. In the joint study report, it's mentioned that the possible introduction of the virus through an intermediate host to humans is likely. So about hosts, what is the consensus between Chinese and international experts? I'd like to ask Professor Tong to take the question. Thank you for this question. The wild animal natural host or potential natural host of SARS-CoV-2 is not yet ascertained, and virus may have been introduced from a natural host directly to humans, so a direct jump. It could have been like other coronaviruses or SARS. There may have been an intermediary host. About the tracing of animal hosts, the National Administration of Grassland and Forestry and MARA conducted sampling in 31 provinces and regions, and more than 10,000 samples were tested both for NAT and for antibody, and there was no positive result. It shows that around the outbreak in China, we did not find evidence of virus circulation in animals, both domestic and wildlife animals. And scientific evidence today suggests that the coronavirus sample taken, RATG13, in Yunnan in 2013 was about 96.2% homology, and the other one is about 93.3% to SARS-CoV-2. And in 2015 and 17 in Zhejiang, Zhoushan ZXZ21 and ZC, those two viruses had about 87% homology to SARS-CoV-2. And recently in Cambodia and Thailand, in bats, we have tested out coronaviruses that have varying degrees of homology to SARS-CoV-2. Some are over 96. No virus is over 96%. Other reports are saying that in 2017 in Guangxi, in the smuggled pangolin samples intercepted by the Guangxi Customs Office, there was about 85.5% homology in the virus tested in the samples. And also similar coronaviruses with about 90% homology were found in other custom intercepted pangolin samples. So today we haven't been able to establish the exact natural host of SARS-CoV-2, but bats and pangolins are likely culprits. And we have a consensus between Chinese and international team members that the hypothesis is not confined to any geography, and we've taken an open-minded approach from the very beginning. The spillover from animal to human to the seafood market in Wuhan, this may have been over an extended period of time, and this may have involved some cross-border movement. We know bats fly, and they hide in caves mostly in rural areas and mountainous areas, and they habitate in groups. There's a possible cross-infection among the animal populations. For the viruses that we have detected that have high homology to SARS-CoV-2, most of them were found in Yunnan, bordering Southeast Asian countries, and I said similar viruses have been found in Southeast Asian countries. That's why in the global study framework, it's necessary to conduct further study to understand the situation. And pangolin, which is an animal of interest, is widely distributed in Southeast Asian countries. And for the two high homology viruses that we have found, they are also found in pangolin samples. So it's likely that some of the pangolins in Southeast Asia may have carried SARS-CoV-2 or similar coronaviruses, and they require further study. Hopefully, under the leadership of the WHO, we could work as a team and perform further study in the global study framework. Thank you, China Daily. There's been international news reports saying that 3 employees of Wuhan Institute of Virology were ill in early November 2019, and they had similar symptoms of SARS-CoV-2 and influenza. It could have been the source of the virus. What's your take on that? Thank you very much for that question. This is Professor Tong. Based on the study by the Chinese experts, we haven't found any so-called infections of 3 employees of the WIV, and the Chinese expert members have also reviewed the meeting minutes on the 3rd of February 2021 for the visit of the joint study group to the institute. So, in answering the questions from the WHO experts regarding the influenza monitoring and surveillance system in partnership with other local hospitals, it was clearly replied that starting 2019, the institute has been working with one hospital in Wuhan to conduct influenza surveillance, and they took samples from January 2019 to January 2020. 1,001 samples of influenza virus were taken, and in March 2020, these samples were taken by the institute for retrospective study because they were equipped to do so. And then the retrospective study finds that 700 plus samples taken in January 2021 showed 4 positive samples of SARS-CoV-2. That means 4 cases had co-infection of influenza and SARS-CoV-2 because they were monitoring influenza cases. And out of the 4 cases of positivity, 3 were adults. 1 is a senior citizen. They were patients in the hospital, not members or employees of the institute. The finding and also the description of the case is being published, so you can refer to the study, to the report.
FS Spanish News Agency. So Dr. Tedros from the World Health Organization said it might be required to have more missions to China. So is China willing to allow another mission in the near future from the international experts about the origin of the virus?
好，请翻译一下问题。
我是这个西班牙埃菲瑟的记者。那我们也听这个谭德赛博士说，这个中方呢愿意在未来呢有可能去接待更多的这个世卫的代表团来华。那我想问一下，近期有没有这样的一个可能，有一些这个世卫的专家再派这个专家团来华去做调查？
好，我们请梁万年组长来回答这个问题。
Professor Liang. Well, I think it has already been asked. And from the perspective of a scientist, origin tracing is work in progress. It's present continuous tense. So for the global origin tracing study, Chinese scientists and like Chinese government stand ready to make contribution to the global origin tracing study. That's as clear as always. Will there be other missions? When do they come? When will they come? What will they do here? It's to be driven by the recommendations of this report. And it will be determined on an as-needed basis. It should be guided by specific plans and programs. At present, it's premature to talk about those plans and programs. We have just had that report published. Thirdly, I think we still need to focus on the most likely pathway out of the four. We have came up with four, and we analyzed arguments for and against each and every one of them. For some work that has already been done, maybe it is just a matter of incremental amount. But for other work item, it is yet to be done in other countries and regions. That's a material difference between the two types of tasks. Then scientists have got to prioritize their activities going forward. Do they expand the scope first, or do they need to explore new areas of research? Well, in the interest of time, we have a final question. Gentleman, second row. Healthcare news. Professor Liang, the origin tracing is a long extended process. Well, some experts had come under pressure from the media, and according to some media reports, China imposed some pressure on WHO experts. How would you comment on this? Professor Liang, yeah. Thank you. Thank you for your question. I have also read some individual reports from some media reports. It is not factual. With regard to the joint team, both Chinese experts and involving both Chinese experts and international experts. Since the departure of international experts from Wuhan, we have kept up our communication and discussion remotely in video conferencing. You know, it is not factual. Nobody has felt any pressure from China. And after the return of the international experts back to their home countries, some of them were interviewed by the media. Others made their voices heard about the process of this joint research. Nobody has said anything about that they were under pressure, their work was interrupted, and some of them have even pointed out that those allegations in a few media reports are contrary to their on-the-ground experience in China. And as DG has said, the Chinese government has done so much to support the mission and the joint study. So let me repeat, for the experts, they have visited all the places, met all the people, studied all the facilities, read all the documents, etc., as they had wished. Sometimes on day one, we continued our discussion deep into the night, and all of a sudden we came up with the idea to see someone or gain access to some documents or data, and we would tell the representatives of the local government, make an arrangement as soon as possible. It's like a surprise visit. It's like it was like a raid from time to time, but they had all satisfied our requirements. Again, I'd like to thank the local hosts for all the facilitation provided. I watched the press conference of WHO. WHO experts said that without their support, we couldn't have achieved so much. Even for the Chinese experts, when we came to those facilities or sites, we didn't know whom to talk to and whom to meet. But thanks to the help by the local authorities, we had achieved our objectives. Yes, there has been pressure, but of a different sort. After the conclusion of the underground work in Wuhan, I myself felt some pressure after reading some reports and assertions. It is a source of pressure on me and on my fellow experts. But both Chinese and international experts are confident in our findings. We have always observed a science-based approach. We are separated from politics in our work. Thank you. Thank you. I'd like to thank all the experts for your replies and answers. Thank you for your briefing as well. I'd like to thank the international experts who have joined the joint study. Thank you. I'd like to thank them for their contribution too. That's the end of the press conference today. Thank you all for coming.